What is the PCL? Hey, this is Dr. P. Got a problem with your knee? Ask Dr. P. And I got asked a question about the PCL as opposed to the ACL. So the PCL is the posterior cruciate ligament. The ACL is the anterior cruciate ligament. And they are ligaments in the knee. And the knee has four bones: the femur, the thigh bone, the tibia, the shin bone, the fibula, the outer leg bone, and the patella, the kneecap. And there are also four main ligaments. Ligaments connect bone to bone. So there's the MCL, the medial collateral ligament, along the inner side of the knee. There's the LCL, connecting the two bones together on the lateral, the outer side of the knee. There's the ACL, anterior cruciate ligament, deep in the knee that prevents rotating of the knee and instability when you rotate, and it attaches on the anterior or the front part of the shin bone. And then in the back, there's the PCL that attaches on the back part of the tibia, the shin bone. The PCL prevents the shin bone from sliding backward on the thigh bone. And it's not quite as important for cutting or pivoting as the ACL is, but it does get injured. It gets injured if someone playing sports, if they land with the front of their shin bone on the ground, it'll sometimes injure that. The classic dashboard injury in a car, if you get into a car accident and the front of the knee hits the dashboard, it can tear the PCL. The cool thing about the PCL is that even if it's torn completely, like we see on this MRI here, here's the thigh bone, the femur, here's the shin bone, the tibia, the kneecaps here, anything that's white is fluid. And so ligaments are usually black or dark gray, and you see part of the PCL up here and part here. This was completely torn here. That one is going to be a lot more difficult to heal, but even those have healed. You look at Barry Sanders, played in the NFL with a torn PCL. Marshall Faulk, Connor McDavid, a hockey player, had a complete tear, got it to heal. So unlike the ACL, which when it tears completely, a lot of times will not heal, the PCL can heal, especially at grade 1, which is just a very, very mild stretch. Grade 2, a partial tear, those will almost always not need surgery, especially if they're isolated. A grade 3 sometimes needs surgery, but we're not really that good at doing surgery on the PCL, believe it or not. It tends to loosen up even after surgery. So what we did in this case was we injected some bone marrow cells and PRP into this. We also did a laser program. We did a total body fitness program. One of our knee repair, not knee replacement programs, to try to get that to heal. And so far that person's been doing very well. But the PCL is the posterior cruciate ligament, and it doesn't always need surgery. It needs surgery a lot less common than the ACL does.